Hello, this is Paul Bonyo. I'm doing my urinary catheter practicum today, and before I start doing that, I'm going to confirm my medical order for the underwhelming catheter for insertion. I'm going to review the patient's chart for any limitations of any physical activity and presence of any other condition that may interfere with the passage of the catheter or contraindicators of insertion of catheters. Then I'm going to review for allergies. I'm going to consider the patient's ability to follow directions. I am going to uh, I'm going to consider the presence of all other tubes, drainage lines, or any other that may interfere with the performance of the procedure. I am going to gather my kit and any other necessary equipment needed for the procedure. I am going to consider assistance from any other staff if necessary. After which I'm going to enter the patient's room, provides for privacy. I'm going to perform proper hand hygiene and put on the necessary PPE that is needed. I'm going to introduce myself, in which I'm going to say, "Hi, I'm Paul Banya. I'm going to be a primary nurse today." And then I'm going to identify my patient and confirming it with the name tag attached on their forehand. I'm going to discuss the procedure in which I am going to do to the patient, and I'm going to ask the patient if he has any allergy, especially to latex or iodine. I am going to provide good artificial lighting so as to have a proper view of the procedure. During the procedure, I'm going to adjust the bed to a comfortable working height, most likely the elbow height. I'm going to stand on the right side of the bed since I'm right-handed, and if I was left-handed, I will stand on the left side of the bed. I will position the patient on the back and the thighs slightly apart. I am going to drape the patient so that only the area of the penis is exposed. And I'm going to put on clean gloves. I am going to ask the patient to lift their buttocks and place a waterproof pad underneath them. I'm going to clean the perineal area with a washcloth and skin cleanser and with using warm water too, so as to put the patient in a very comfortable position, not using cold water which will make them feel uncomfortable. I'm going to clean the tip of the penis first, moving the washcloth in a circular motion after circular motion out from the miliatus outside. I'm going to wash the shaft of the penis using the downward stroke towards the pelvic area and rinse it dry. And I am going to renew the gloves and perform hand hygiene again. After performing hand hygiene again from cleaning the pelvic area, I am going to open my sterile catalyzing tray on a clean bedside table using a sterile technique by opening it away from my body. And then I am going to keep the outside plastic wrap from the trash. I'm going to discard of all towelettes and hand prep. I'm going to pick up a sterile drape by the edge and unfold it without touching the sterile area. I'm going to ask the patient to lift the buttocks and slide the sterile drape with the shiny part facing under the patient, like the downwards part. And then I'm going to put on the sterile kit. I'm going to place a penetrated sterile drape over the patient perineal area with opening under the penis. I'm going to pick a kit with the outer drape included and place the sterile trail drape between the patient's thighs. I'm going to remove the top tray and place the next to the bottom tray and keep both of the sterile drape. Oh, I'm out of breath. I'm going to open all supplies, open the better-made swab kit and attach the water-filled syringe to the inflammation pot. I am using the lubrication syringe. I'm going to deposit lubricants into the tray top compartment. I'm going to remove the follicle catheter from wrap and lubricate 6 inches of the catheter because it's a male, and be 2 to 3 inches, I believe, for female. I am going to open the specimen container. I'm going to open the container with specimen in the tube, the substance, and I'm going to tell the patient that he will feel my touch before I touch it. After warning my patient that they will feel a little bit of touch, I am going to lift the penis with my non-dominant hand. I'm going to retract the foreskin. If in an uncircumcised patient, I am going to keep my non-dominant hand in position until the catheter is inserted and urine flow is well and is continuous. I am going to using my dominant hand, so I'm holding the skin like this, like this, hold it down. I'm going to leave it in place until this is inserted. Using my dominant hand, I will pick up the antiseptic swab. Using a circular motion, I'm going to clean the penis, moving from the meatus down to the glands of the penis. I'm going to repeat the motion 2 or 3 times using a new swab each time. I'm going to discard of each the swab after using one. Also, I'm done using them, I'm going to discard them. While holding the penis with slight upward tension, I will use my dominant hand to pick up a sterile catheter and hold it inches, hold it 1 to 2 inches from the top. Ask the patient to bear down as if they are voiding. I'm going to insert the tip of the catheter into the meatus and ask the patient to take a deep breath. And then I'm going to advance the catheter to the Y level of the port, and I will not force it to too much pressure it while introducing the catheter. If I meet any resistance, I'm going to ask the patient to take a deep breath, and I'm going to rotate it slightly, and then hold the catheter and then once it's all fully inserted, I'm going to hold the catheter securely on the meatus with my non-dominant hand, because at that point I've started seeing urine output, cause I could see as if I've reached the bladder. I'm going to use my dominant hand to inflate the catheter balloon. I'm going to inject the entire volume of the sterile water supplied in the kit to fill this, in the case of the kit syringe, to fill the balloon. I'm going to pull gently with that little, just gently, so I was not apply pressure on the wall of the bladder, so I to see the catheter as fully attached and there's no drains coming out from the catheter. After which I am going to attach the drainage system if not already pre-attached. I'm going to remove equipment and dispose of it according to my hospital or what the facilities require. I'm going to discard of my sharps in the sharp container, and I'm going to wash and dry the perineal area and remove the gloves. I'm going to secure catheter tubing to the patient's inner thigh, and then I'm going to leave the catheter from the leg, assist the patient in the comfortable position, cover them, and place the bed in the lowest position. I'm going to put a collar within reach. I'm going to secure the drainage bag below the bed of the catheter, check the drainage tubing is in kinked, and that removed the side rails down, so the patient won't be in a restriction. I'm going to perform my hand hygiene and perform proper documentation of the catheter. And I believe we do all this to prevent the sterile technique and all those stuff, so that we prevent infection and all those stuff. infection or UTI. And I believe that's it for my practicum.